Good afternoon and welcome to Caregiver Conversations. Today our special guest is Shell Johnson. She's from the INCOG Area Agency on Aging. Shell graduated with a master's in gerontology from Oklahoma State University. She's originally from Kansas City, Missouri, and newly just started a planner role at the INCOG Area Agency on Aging. Welcome, Shell, and we're glad to have you with us.
Thank you. Thank you. I'm glad to be here. Glad to be here. So
Okay.
I wanted to begin just talking about some of our programs for INCOG Area Agency on Aging. A lot of people do not know about us and who we are, and we actually fund quite a bit of programming for our seniors, for our caregivers. And so we just want to make sure that we're getting everything out and so that people know where to turn when they're in need of any type of resources. So once again, INCOG stands for Indian Nations Council of Governments, and it is located here in downtown Tulsa. And I work for their department of Area Agency on Aging. And once again, I'm their planner. And hope you guys find this resource guide useful, and it's always available. And at the end, we'll give you contact information for everything that we'll talk about today. So go to the next slide.
All right.
So just to start things off, our mission is to improve the quality of life by promoting independence, dignity, and health focus for senior citizens in Creek, Osage, and Tulsa counties through advocacy, education, and support of community-based services. So once again, there are many COGs. You can go to the next slide because this will help me explain this. This is our networking. So we get our funding from the Administration on Community Living, the Administration on Aging, so that's the federal government. Those funds get pushed down to the state unit on aging, so the OKDHS Aging Services. Then they push funds down to us, all the area agencies on aging. It's more than one in Oklahoma. And then we decide how we split those funds up for our services, whether indirect services or if we directly give a service ourselves out of our office. The next slide. So this is just a map describing all of the area agencies on aging in Oklahoma. So once again, I work for INCOG, and that is the Tulsa County, Creek County, and Osage County. Those are the counties that all our services cover. So on this map are all the other area agencies on aging, also known as AAAs. And so you can, if you don't live in our counties, you can find your county on this map and then reach out to your COG who would have some of the same programming and funding that we have that can help you with anything you need. Next slide. So this is just a little bit of information about the Older Americans Act. This is how all the AAAs are funded, and this is how we provide services to our communities and to our seniors. So the Older Americans Act was signed into law in 1965, which we are all so grateful for. And then attached to that was Medicare, which is the health insurance program for the elderly. And then of course, attached to that was the Medicaid, which is the health insurance program for low income persons. It was also added to the Social Security Act. So in 1987, the Older Americans Act was reauthorized, and it includes these 6 distinct services. So you have the in-home services for the frail and elderly. That covers things like homemaker, in-home nursing. Then you have long-term care ombudsman. Those are goes into nursing facilities, make sure things are up to par. They take complaints, and also they take praises too for in-home and nursing services as well. And they use those complaints to go out and investigate those and make sure that our seniors that are in long-term care facilities are getting the best treatment that they can. Also assistance for special needs, health education and promotion for our seniors, prevention of elder abuse, neglect, and exploitation. So that is where you call your senior abuse line. That ties into that. And then number 6 is outreach activities for persons who may be eligible for benefits under the SSI, Medicaid, or food stamps. And that's just to make sure that all seniors, all those who are eligible, have a one place to go to where they can make sure that they have everything they need to access these benefits and know the agencies who are charged with providing these services to our seniors. Go to the next slide. So in 1992, it was reauthorized again, and it focused on our caregivers, our intergenerational programming, which just means mixing programs with our children, within our teens, into our older Americans, so mixing those populations. Then you have the elevation of the Commissioner on Aging to the Assistant Secretary for Aging. And then in 2000, it was signed into law establishing the new National Family Caregiver Support Program. And then here in this year, in 2020, it was reauthorized for the next 5 years. So we don't have to cross our fingers anymore. We're guaranteed funding, and we're guaranteed to have services for our seniors as we get more and more Americans aging. And in fact, the funding for us is supposed to increase each year about 5 to 6%. So that's also exciting.
That's great.
So this is just a map showing how America is aging and aging over the next couple of years, couple of decades. So right now we sit in 2020 and we have around 50 million of Americans that are age 65 and older. And by the time we get to 2050, which is just a short 30 years from now, we'll see over 80 million Americans that are 65 and older. So, the time is now to get moving, get preparing, get planning for our abundance of seniors that will be. So by the year 2030, which is in a short 10 years, all the baby boomers will be age 65 and older. 1 in 5 Americans will be 65 and older. There'll be 78 million 65 and older compared to the 76.7 million under the age of 18 by 2035. And that statistic just blows my mind because it'll be more of the older than the younger, which it's always been the opposite. And the U.S. Census predicts in the year 2030 that 24.4% of Oklahoma's population alone will be seniors 60 and older. So Oklahoma, we got to keep moving forward. And this is to just show you guys how the federal spending is broken down and how the Older Americans Act is funded. So you have the total, our total budget for the United States of America, and the Older Americans Act is funded out of discretionary spending, which is about 30% of that budget. And then the Older Americans Act actually is 0.6% of that budget. So it seems like a very small percentage, but we stretch it and we make it work. So now I'm going to get into what the INCOG AAA serves. We serve Title III services. And so these services are granted out of the Older Americans Act, and they're funneled through the AAAs within your state. So within Oklahoma, in the Tulsa Creek and Osage County, it would be INCOG. These are some of our services and programs. So for our supportive services, we will start off with our homemaker service. It is provided by Oxford Healthcare, and some of the benefits and some of the establishments that you have to receive this care have to be 60 or older with a high risk score and inadequate or lack of support. This service helps seniors with meal prepping, shopping, light cleaning, and laundry. Last year, Oxford Healthcare provided 11,977 units of service, which is amazing for our 3 counties. We've worked with Oxford Healthcare on this service for a very, very long time, over years, and they do a wonderful job. This is available to all seniors who meet these qualifications. And at the end of this recording, at the end of this talk, you'll be able to know how to contact them if you want to set up your loved one with this service. We also offer legal assistance and education, and this service is funneled through the Legal Aid Service of Oklahoma. So you must be 60 or older in need of legal advice, assistance, document drafting. Document drafting could be your will, dual powers of attorney, and they will help you do these documents for free. And it's very important that we stress to our seniors to have some of these documents in place just for later on and for easy planning for your loved ones. They also provide community education presentations in many of our senior centers across our 3 counties. And they provided 24 community presentations last year and about 1,795 units of assistance. So our next, which is one of our largest requested services, is transportation. So for Tulsa, the Tulsa area, we have Morton Comprehensive Health. They provide our transportation for if you're in the Tulsa area, Tulsa County area. And then Cimarron Transit, They provide transportation for our Osage Creek and county areas. And you can request to go shopping, have a shopping trip, which that includes grocery store shopping, medical, so that means you can go to doctor's appointments, and nutrition trips, which means you can be taken to a senior center for lunch every day, those type of trips. We do have, sometimes they will offer social trips as well if we have enough, if we don't have a high demand for our required trips. So you just must be 60 and older. You can bring a companion to shop along with you and to help you get around if needed. And once again, you just will call one of these two providers and they will get you set up. Once again, at the end of this presentation, you will have the contact information for them. Another part is we do nutrition services for our seniors. So we serve congregate meals in Osage Creek and Tulsa County. You must be 60 or older. Your spouse can come with you if they're 60 and older. We have volunteers at the nutrition centers who are under age 60. If you want to volunteer, it's a great place to volunteer to help cook, help serve our seniors. If you're handicapped or disabled and you live with an eligible person, meaning someone 60 and older, you can attend the congregate meal as well. If you're handicapped, disabled who lives in elder housing, where the nutrition center is located. We have a lot of our congregate meals are served within our vintage housing here in Tulsa, which means people live there as well. And then they have the kitchen and dining room kind of on the first floor level. So if you live in one of those communities, you're always welcome to attend the congregate meal. And so our congregate meals are served through Osage County Nutrition and Tulsa and Creek County Senior Nutrition Program. There are two providers that serve our seniors through congregate meals. Our congregate meals, you must come each day. They start serving the meals at 11:30. You will have to have an intake form completed. They will have to get some general basic information on you just to make sure you're eligible for the meal and that you're not in need of any other additional services that they can provide for you. And so it's really a good way to go out, get connected, get some socialization with other seniors, and just to enjoy a really good nutritionally balanced meal. Along with that, we also serve our home delivered meals for our seniors who cannot get out of their home. So we have the same two providers for those meals. So Osage County Nutrition provides congregate and home delivered meals in Osage County. Tulsa and Creek County Senior Nutrition Program, they serve our home delivered and congregate meals in Tulsa and Creek counties. So once again, you must be 60 years and older to be eligible, but to receive my home delivered meal, you could be a spouse living with the recipient of a home delivered meal, meaning if they're homebound, it's hard for the spouse to get out and get things they need, so they also would be eligible to receive a home delivered meal. Or the person has a disability and they will be eligible to receive a home delivered meal as well. You must require the assistance of another individual to leave your residence in order to qualify for a home delivered meal. And some participants get daily hot meals from our providers, or some rather just get a weekly delivery of frozen meals, which means they get 5 to 7 frozen meals delivered maybe on Monday, lasts them throughout the week, and they get that shipment every week. And so last year we served around 186,000 meals, and so in all 3 counties. So we're very excited about that, and we hope to drum up more interest in our congregate and home delivered meal programs to make sure that we are reaching all of our seniors to capacity. And so along with that, we have our nutrition education, and this is provided through a registered dietitian by the name of Mike Lundy. He provides monthly education literature and bi-monthly presentations at all of our congregate sites to all meal participants. So if your loved one would like to go and be served a congregate meal, they will also be educated every month about different dietary nutrition restrictions, different things like blood pressure and blood sugar, how to keep those low, how to keep moving, how to stay active. And he also provides one-on-one nutrition counseling. So you can set that up through our INA specialist, which I'll talk about soon, or you can just tell the site manager at your congregate meal or whoever delivers your homebound meal that you would like to receive counseling. And you can receive counseling on, like I said, high blood pressure, how to lose weight, how to gain weight, how to maintain a healthy lifestyle. He's really with that. He can do those in person or over the phone. You must just be 60 years or older and you qualify to receive that service, and it's a really, really good benefit. He helped about 190 seniors last year with nutrition counseling, helping them get their diets back on track for their specific dietary needs. So also we provide a service through our disease prevention and health promotion program. And this is through our organization called Ability Resources. The senior must be 60 years and older, and they have two types of programming that they offer. They offer DEEP, which is the Diabetes Empowerment Education Program, and they offer Tai Chi for arthritis for falls prevention. And so both of those courses are a little bit different. You would sign up with Ability Resources, and the Diabetes Empowerment Education course lasts about 8 weeks, and then the Tai Chi courses last about 16 weeks. And so that senior will be charged with coming to those programs once a week until they complete the program. They get a certificate to let them know that they've completed the program, and you get, for the DEEP program, they gain a lot of personal information to help them navigate diabetes, having diabetes, or their loved one having diabetes even better. And then the Tai Chi for arthritis programming really helps them learn how to move and balance their bodies so that they are able to, strengthen and be able to work through any aches and pains and just keep them physically well without having to do a lot of hard, intense exercising. And then we have our family caregiver information services, which is, of course, provided through Morton Healthcare, and is led by Miss Martha, who is awesome. And this is caregivers caring for someone 60 years or older. She provides workshops in group settings, presentations, and education for all caregivers, which is one of the things that we're doing right now with this video. And last year provided 129 presentations, reaching around 3,500 caregivers in our counties. And that is just amazing. We also offer caregiver respite through Oxford Healthcare. So our caregiver caring for seniors 60 years or older, they provide caregivers with a break. So we have around 197 caregivers who were served last year with 16,000 hours of respite in 2019. And once again, these are for caregivers who do the primary caregiving for their loved one or friend, and maybe they need a break to run to the grocery store for an hour, to maybe attend a doctor's appointment themselves for an hour, or just to get a social breakaway from having to fulfill that caregiver role. We all know that caregiving can be a lot. It's very taskful. It's very task oriented. So sometimes caregivers just need a mental break, and caregiver respite provides that option for our caregivers, for free. And they have many ways they do that. They have the voucher program, which means that the caregiver finds someone who can relieve them for that time and then pay them through that service. They can have their loved one attend a day center as well. So there's many options that they can go about with receiving their caregiver respite. Then we have grandparents raising grandchildren respite, which is also offered through Oxford Healthcare. It's for any grandparent 55 or older responsible for a child. Doesn't have to be just a grandparent legally. It can be anyone who has guardianship that is 55 and older and responsible for a child. So it could be an aunt, an uncle, anyone of that caliber. Last year, they served 29 grandparents with around 2,100 hours of respite in 2019. And this respite can be used for children to go to summer camps, after school programming, or simply just to have someone look over it after the child while they just get an hour or two of a little break. So for all of the services that I have mentioned, and plus many more, because we have some programming that's seasonal, that comes and goes. We have eye exam and eyeglasses that is also provided through Morton Healthcare, where you can get your eyes checked. You can receive a free prescription and free glasses, so that's a seasonal program. So always call INCOG AAA. If you're statewide, our number is 1-800-211-2116. And if you live within the counties that we serve, the number is 918-579-9477. And once again, that is our starting point. You reach out to the information and referral line. You talk to that person about what you need, what your loved one needs, what you're looking for, whether it's congregate meal service or transportation or you want to get connected with the caregiver information group, whatever your need is, that is a place to start. And she will write up a referral for you, and she will refer you to those agencies that offer that service. So if you are in need of any in-home service, you will also be contacted and visited by our outreach workers. So for example, an in-home based service will be home delivered meals or homemaker service. You must be 60 years and older. So like I said, those requiring in-home services. And then they also will check to see if that senior or if that your loved one is looking for any other services outside of the Title III programming. That can be SNAP, dentures, personal care, maybe home repair, which is also a program that we offer as well. So it's really important that you call our information referral line and really explain what you're in need of, what your loved one may be in need of or lacking, so that they can get a full picture and then refer you to as many providers and as many resources as they can to help you guys allow that senior to age in place, allow that caregiver to have some break and respite, whatever your needs are individually. We also have our ombudsmen who are advocates for residents in long-term care facilities. So whether you might be a part-time caregiver, or you might be charged with making sure you're checking in on mom and dad or grandma and grandpa as they live in a long-term care facility, and you might see some things that are unfavorable for you in the care of your loved one, call our information referral line, and she will refer you to our ombudsman, or you can file a complaint with them and tell them what you saw, and they can look up and investigate that and make sure that all of that is corrected while including you and your loved one in the whole process. So those are our direct services from INCOG, and all the other services, they're indirect services, which means they are contracted out to our agencies and they provide those services for us within the community. So here are all our providers that I just talked about. These are their logos, that if you see these logos, you can kind of make a connection with who they are and what they do and what they stand for.
Stop our share right now, and then we can get back to
talking. Yeah.
All right. That's an amazing amount of services that people can access through the Area Agency on Aging. I know things have changed a little bit because of COVID-19. What kind of changes have you made, and how can people still get services in the midst of COVID-19 problems?
Yes, that's a good question. So I feel like one of our main services that has changed the most dramatically has been our congregate meal service. It's not really safe or beneficial for our seniors to come into one place like a senior center and get their meals and eat. So what our providers have decided to do is to provide to-go meals for our congregate participants, which means they just drive up to the senior center. They don't have to get out their car. They get their meal for that day. They let the site manager know if they would like a meal for the next day, and it's point blank simple. Everyone's serving the meal. The meal is packaged in to-go containers. Everyone has on a mask, using hand sanitizer, has on gloves. And it's also a good way that we get to kind of check in with those seniors that are coming. We get to see their faces, ask how they're doing, while also for giving them a meal. So all of our congregate sites are closed for people to come and congregate, but we do have the to-go meals that they're able to access. And some of our providers are even giving our congregate participants seven meals for the week, 7 frozen meals for the week. So they don't have to get out and come up to the senior center every day, but they still get that nutritious meal, and we don't have to worry about them being hungry or being without that. Another thing that has changed, our outreach workers may receive, our INA specialists may receive some calls for those who are just simply homebound, really don't have anyone to turn to, and may be in need of some specific things. And so we've also been taking those type of calls and trying to do everything within our power to make sure those individuals are getting, toilet paper or dog food or whatever they need. We had also put a halt to our homemaker services, because they go into the home and care for and provide the service. And so we're just beginning now to kind of start that service back up if the senior is comfortable allowing the worker to come into their home, of course, with the mask and with gloves, and still trying to practice social distancing while they're in the home. If they're cleaning the kitchen, maybe the senior is in their bedroom or in the living room, certain things like that. We had to put a stop to our workshops. So our deep workshop and our Tai Chi workshops have not resumed yet due to a lot of the facilities, parks and libraries that they were housed in are still closed due to COVID-19. And we are working to figure out a game plan on how to resume those classes because they're really hands-on courses. It's really hard to get the same feel and have the same impact with them being virtual. So we're working through kinks to try to get those services back, but right now they haven't been provided due to COVID-19. Our transportation services have limited their rise to not emergency, but dialysis, medical trips, and certain things like that, and just been taking more precaution to wipe down the van between trips and use hand sanitizer and wipe their guardrails and those things like that, but they are still serving.
Great. You guys have made a lot of adaptations to keep
yes, very quickly too.
Very quickly. Yes, there wasn't a lot of time for all of these
changes. Yeah.
So is there anything else you'd like to share with the group about anything personal that you'd like to share about services or seniors or anything else?
Sure. I really just want to drill the point home that a lot of seniors and their loved ones are really inadequately informed about INCOG and all COGs and all AAAs. They kind of get into a fuzz about what we do and how we provide services. So I really hope that people can watch and listen to this video over and over so that they can really hone in on what services we provide, because our goal is to reach as many seniors as we can and get these services out there so that people are not feeling that they have to care for their loved one alone, or that a senior feels like they're alone. These sources are out here. They're funded by the federal government because they know that our seniors are in need. So I feel like we have a high population of seniors who are not accessing these resources and who just simply don't know. So the more that those who watch this video can spread this information out, share the number, share the information resource numbers, share the names of these agencies that are doing this awesome work for us, just to get it out there so that we are serving as many seniors for as long as we can. I feel like that is most important, that we want to reach as many seniors as we can with these services, because these services are for them. They're not for anyone else but them. And so it would be a disservice not to reach and not for the caregivers and the seniors to use these resources.
And I think there's a lot of misunderstanding too. People think I can't qualify for that, but I keep telling them with these programs, Older American Act program, it's age related, not necessarily income or anything like that.
Yes.
And it's a difference than a lot of other programs that are out there.
Absolutely. Absolutely. And I know sometimes people get, once you keep calling agencies and they say, well, we don't do that, or we're out of funding for that. And you kind of get disheartened and you're like, well, I don't want to call anyone else. They all give me the same answer. But, just always keep trying. Always, if an agency is out of funding for something, call them back within a month or two or within a quarter, because funding always comes back, And so I just want to encourage caregivers, encourage seniors not to give up and not to stop searching for the resource that you really need.
That's right. You want to give everybody the number one more time so that they'll know where to call?
Yes, ma'am, I sure will. So if you're statewide, the number is 1-800-211-2116. But if you or your loved one lives in Creek, Osage, or Tulsa County, then you can call 918-579-9477. And you will get contacted with our information and referral specialist, and she's amazing.
That's great. Well, thank you so much, Shell, for being here.
Thank you for having us. Thank you so much.
Well, we're excited to share good news about you guys and all the programs that you have, and hopefully more caregivers and seniors will be able to utilize some of these programs and make that phone call.
Yes.
And the people there are wonderful. They're easy to talk to, and I think any caregiver or senior would find a very welcoming voice on the other end of the line when they give.
Oh, yes, definitely.
So we thank you so much for joining us today for Caregiver Conversations. Thank you, Shell.
Bye-bye. Thank you all.